this knowledge is something we need and benefit from and will help us through the various life stages as we age, as we lose collagen, as we lose muscle mass. We have to fight against that. We have to fight hard. And if we have the knowledge, we're armed and ready and we know what to do. If we don't have the knowledge, we don't quite know what to do, or that there's even something that we need to fight for.
Wow. And you're right. This is a lifelong journey. This is not just for mamas after birth. This is for every age, every stage. Hello and welcome to the Mama Culture. This is a place for you to be supported, inspired, and resourced on your unique journey through motherhood. I'm your host, Corey Zorns, a fellow mama, here to bring you information and wisdom on parenting, wellness, personal growth, and everything in between so you can thrive as a modern mama. So grab your favorite warm drink, settle in, and get ready for relatable, honest, and empowering conversations about the most important job in the world. This is the Mama Culture. Hello, everyone. I am so excited for our guest today. So to start off with, I was at the gym the other day and I ran into one of my trainers. I was just going to the sauna and the cold plunge, and I ran into one of my trainers and he said, "Oh, I haven't seen you working out for a while." And I was like, "I've been really tired lately. I don't know if you know this, but I have a toddler." And then I said, "I'm also working on pelvic floor health. So I've also been gentle with my workouts lately. And I've been doing a lot of Pilates reformer." And he was so excited. And mostly when I tell, especially men at the gym, that I'm working on pelvic floor health, they're like, "Oh," and they kind of just stop talking. One of my trainers, it was a boxing class, and we were jump roping. And I was like, "Oh, I'm going to skip jump roping." And he's like, "Why?" I'm like, "Oh, pelvic floor." And he's like, "Okay." And he just like turned around. It was like, okay, no questions on that. I felt like he didn't know what to say. Like, "Oh, what's going on?" So anyways, but this specific trainer was like, "Oh my God, that's amazing." He's like, "I took a course all about pelvic floor health from the Vagina Coach." And I was like, "Tell me everything." So we had this amazing talk about you, Kim. And he was just telling me just how important this work that he learned from you was. And he did the course so he could share it with the people that he was training. So I started looking into you and I was just immediately obsessed. I'm obsessed with your vibe, everything you share, everything you teach. I just think you're beyond amazing. So with that, I'm going to introduce you.
Thank you.
So Kim Vopni is the go-to for all things vagina, pelvic floor, Kegels, fitness. She is a self-professed Kegel maven, certified fitness professional, doula, author. Your most recent book is called Your Pelvic Floor, and you have 2 other books, Prepare to Push and Pregnancy Fitness. Kim offers health programs, courses, coaching for women. She has an app with a dedicated community, which is called the Buff Muff, which my partner thought was so hilarious and so genius. Podcast is called Between Two Lips. You are truly the go-to in this space, and you are a mama of 2. So thank you so much for being here. I'm so excited. I have so many questions and so much to dive in with you.
Thank you. That was a really lovely introduction. And I will say I have that same experience with especially men who just sort of go, "Oh," and they turn the other way. And also, I love when men come. I remember last year I was presenting at a fitness conference, and I'd been presenting there for 10 years, and pretty much every single session is full of women. And every once in a while, there would randomly be one guy. But last year, there were all of my sessions had at least 5 guys, and a couple of them came to all of them. And I thought, hallelujah, it's finally getting out there. And so I love hearing that men have taken my course. This is essential because most of the people that they're training are women, and it's important for them to understand the changes that the female body goes through, not just through pregnancy and birth, but through life. And then they can have the tools to support it.
Yeah, I find that so important. All of our fitness trainers, I think most of them don't have a huge understanding of this work that you do of pelvic floor health. So if we don't come in as a student with our own knowledge of what's going on in our bodies, which I didn't have that knowledge, like I'm Googling it and trying to figure it out. So I'm so excited for you. But we go into these fitness classes, and this could be any point in your life, or having a baby, 1 year postpartum. I'm several years postpartum now. But I'm like, should I be doing this workout? Does this feel good? Like later I'm feeling stuff in my pelvic floor. So yeah, if all trainers had this knowledge, and a lot of our trainers are men. And I love what you said, that more men are coming to train with you, because I find it so important. And it's really easy for them to shy away from the topic or shy away from this conversation. But man, this is really impacting our bodies and just vital for all women.
Yeah. And when you really think about it, and when you learn what the pelvic floor actually is, a group of muscles, we arguably, every single person who is becoming certified as a fitness professional, as a personal trainer, as a movement guide, why are we all not learning about the pelvic floor? We learn about all the other muscles in the body, and arguably the pelvic floor is one of the most important, especially when we're thinking about core exercise, right?
Mm-hmm.
And so I really have been petitioning for a long time to have our initial certification courses in fitness. So the certifying bodies, this should be fundamental information.
Yeah. I'm excited for you to just demystify the pelvic floor, the vagina, Kegels, what is going on in our bodies. Like, it just really needs to be demystified because it's this like secretive thing, and not that many people want to talk about it or hear about it. And wow, this should be the biggest topic that we are having. So I can't wait to ask you so many questions. And I personally want to learn so much too. The first thing I want to talk about is pelvic health physiotherapy. And I heard you mentioning this on another podcast, and you said that all women should see someone annually. And I found that fascinating. I've never seen a pelvic health physiotherapist. I really want to see a pelvic health physiotherapist. So I'm wondering, should all women see them annually? Is it post-birth? Do we all need these checkups and assessments? And then what does an assessment look like?
In my opinion, yes, we would all benefit from seeing one annually. And I look at it the same way I would look at a dentist. We have been conditioned from a young age to brush our teeth twice a day, floss, go see our dentist once or twice a year for a checkup. And we go, even if we have no toothache, we have no concerns, we just go for our checkup. And I argue that same philosophy should be applied to this really important group of muscles called the pelvic floor, where we see a dedicated professional who can evaluate function, can look at the integrity of the structures, the skin, monitor for changes, screen for things like incontinence and organ prolapse, which incontinence statistically reported cases somewhere around 40%, reported cases of prolapse around 50%. And so I think those numbers are actually a lot higher than what is reported, because a lot of people think it's normal. We're told that it's normal. It's just part of aging. A lot of people are dismissed by care providers. And so I think that if we had a seed planted earlier on in life that we have this really important group of muscles, both male and female have a pelvic floor. But females, we menstruate. Many of us become pregnant and give birth. We all go through menopause, and the hormonal fluctuations we have through life put us at additional risk compared to men. So I think that, again, if we had that seed planted earlier, it would really change the trajectory and really help remove some of the stigma, also the suffering and silence that so many people go through. And so pelvic floor physiotherapists or physical therapists, depending on what part of the world you live in, are physical therapists who have additional training in the pelvic floor. So they are licensed to evaluate and treat beyond the opening of the vagina. They can assess the internal structures. They can look at external genitalia. They can assess for function. They understand movement and the principles of fitness as it applies to a group of muscles. So they can help screen for and diagnose and treat common conditions like incontinence and organ prolapse, chronic back pain, painful sex, all sorts of things. And so again, I argue that if we looked at it like we do our teeth, our oral health, and if we saw a pelvic floor physical therapist once a year, from the time we start to become sexually active, once a year for a checkup, I think it would really change the world.
Wow. I'm so inspired. I'm like, I cannot believe I have it. I actually heard in France that all women post-birth have these checkups included. It's just a normal thing. Everyone has special pelvic health professionals that they see after birth, and that is just included. And in other parts of the world, it's not normalized. So we don't talk about it. We don't even know what's going on. Maybe this is just me, but I imagine a lot of women listening might have issues but not even know it. What can be the issues? What can be the problems in our pelvic floor health? What can be going on that we might not even realize is a bigger problem that we can fix?
I forgot to answer the second part of your first question, which is what happens in a pelvic floor physical therapy appointment. So I'm going to weave that into this answer. So you're right. Because we've never really been told about a pelvic floor, many people don't even know really what the pelvic floor is. Some people reference down there. Things don't feel the same, quote unquote, down there. And sometimes these changes happen after pregnancy and birth. Sometimes they happen after a fall on a tailbone. Sometimes they happen with certain forms of exercise. Sometimes it happens from trauma or a sexual experience. lots of things can contribute to the development of what would be under umbrella called pelvic floor dysfunction. Some of the more common ones would be, the main one would be incontinence. And at least in North America, we are bombarded by messages, especially on TV stations and channels that are dedicated to female followers, with pad companies telling us that light bladder leakage is just part of being a woman, or that this is what happens when you get older. Some people are told by care providers, what did you expect after you gave birth? What do you expect? It's a normal part of aging. And so we're often dismissed, and we just think, well, I can't jump on a trampoline anymore. That's just what happens. And we just put up with it. But incontinence is not normal. Incontinence is like when urine comes out of the body when we don't want it to. And that could be with a laugh, cough, sneeze, jump, standing up from a chair, some sort of exertion. If we leak urine, that is not normal. It's very common. It's very treatable. There's also urgency or urge incontinence. And that's where people will say, oh my gosh, I'm fine. But as soon as I get home and I'm starting to put the key in the front door, all of a sudden alarm bells go off and I can hardly make it to the bathroom in time. So this is like a sudden overwhelming urge. And there can sometimes be a little bit of urine that leaks out, or it could be a full release of the bladder. And it's like crossing the legs, bending over, not making it to the washroom in time. And that can be more life-altering than stress urinary incontinence because, yeah, we could put a pad in and just get the little leaks along the way. But if we have a full release of our bladder and we feel like we're bending over and crossing our legs, that's embarrassing. And a lot of people will start to not go out unless they know exactly where the bathroom is. So those would be urinary incontinence. You can have a combination of the two, which would be called mixed incontinence, and both very treatable. You can also have anal incontinence. So if gas or stool are leaking out, obviously even more life-altering if that's happening. Then we go into the prolapse category. So this is where our internal organs like our bladder, our uterus, our rectum, sometimes our intestines, our urethra, shift out of their proper anatomical position and they can start to bulge into or descend into the vagina. And this is more common than incontinence. Yet incontinence is, we hear about it. Sneeze, pee, peasing, there's all sorts of jokes about it. Prolapse, even though it's statistically more common, we hear nothing. There is absolutely no screening for this at all. So people are really sidelined by this diagnosis, even though 50% of the population has some degree of prolapse, and often they don't know about it because it can be asymptomatic early on. Some of the symptoms could be back pain, sensations of heaviness or pressure in the pelvis, discomfort with insertions. That could be a finger, toy, penis, tampon, difficulty keeping tampons in, can't get your pee out. You feel like no matter what you do, you have to push to empty. You can't get your poop out. You feel constipated all the time. You have the sense of fullness in the pelvis. Those are all very common symptoms associated with prolapse. But again, sometimes early on, we don't have any of those symptoms. Or there's just a disconnect that we aren't connected to that part of our body, that we just brush off any small little changes. And then chronic back pain is one that I bring up because loads of people have back pain and they see chiropractors and massage therapists and they do their core exercise, and which is all great and can all play a role. But oftentimes it's the pelvic floor that we've overlooked. And one Canadian study showed 95% of women with low back pain have some form of pelvic floor dysfunction. So it's very closely tied. And that's very treatable, but people just accept these aches and pains. I'm just getting older. Oh, it's just back pain. Oh, I'll see my physio or my chiro. And if we saw the pelvic floor physio, we could potentially have a better resolution of symptoms. So when you see a pelvic floor physio, they are trained as a regular physio or physical therapist. And they then have the additional training to evaluate and treat beyond the opening of the vagina. So they will look at things like posture and breath, how you move. They'll go through a detailed health history. And then a portion of the treatment with your consent will involve an internal exam where they will use a gloved finger or potentially two fingers inside through the vagina, sometimes rectally, depending on the person. And they look externally at the genitalia. They assess internally. So can they insert a finger? Is there any pain or discomfort with that? When then they ask the patient to contract and lift or do a Kegel, can the patient do that? Can they contract? Can they lift? Can they let that go? They will assess the position of the organs. They'll ask for a gentle cough or bear down to see if there's any descent of the organs. They may have you stand up off the table and do the internal assessment there as well to see if that changes anything, because gravity obviously comes in and plays a role as well. So it's a very thorough assessment. And when we think of how much time we typically have with a medical provider, it's usually 7 to 10 minutes and we're rushed out the door. We don't have time to ask questions. We don't even know what questions to ask. In a pelvic physio appointment, usually the initial assessment will be about an hour. And you have you're asked a lot of questions that you didn't even necessarily know were important, but that will then prompt you to say, why are you asking this and what's happening? And you will learn this incredible amount of information about your body that you feel like, oh my gosh, how have I lived 20 years, 30 years, 50 years, 60 without knowing this? And it truly is life-changing for so many people.
Wow. I just am really inspired because I now want myself and all women to go get these checks. And you're right, there's so much to learn, but there's so much to learn about our vaginas and our vulva, like everything. There's just so much to learn that we have not been taught.
Yep.
I remember reading about the first women that studied vaginas and vulvas and drew pictures and diagrams because it was so late in history that women's bodies were understood, and especially these parts of our bodies. So I just feel like there's so much that we don't know. There's so much that I don't know. And this impacts our entire life. It impacts us birthing children. It impacts our sex life. It impacts our connection with our bodies. It impacts our workouts. So it just mind-blowing how much there is for us to learn. And I feel like this is just such a good step, just going and seeing a pelvic health physical therapist. And that's just the first step to understanding so much more. So on that, can we do our own internal checks? How much can we figure out on our own at home?
Yeah, absolutely. We've never been told. And many people still call the vulva a vagina. So it's like the whole area is the vagina, but it's not. And we aren't told the different parts. We don't know how to do self-exploration. We don't know how to take a mirror and look. Yeah. Some people have, but we've never been told that this is something that could be helpful or normal or a good practice to do. So starting out, if you can't find a pelvic floor physical therapist where you are, you can start out with Google pelvic floor physical therapy and wherever you are in the world. And if you can't find anybody close by, then we have our own fingers. We can use a mirror. We can look. And there are also many pelvic floor physical therapists who do virtual appointments. People that are thinking, oh my gosh, do I have to hold a camera up to my vulva? And some people do with consent, of course. But no, they can often talk you through a guided assessment. So I want to plant that seed as well. But we can use our own fingers. We can look, we can feel with a finger inserted. We can do a Kegel and see, okay, like ideally when we do a Kegel, we should feel a gentle hug around our fingers, a bit of a draw up and then a release. So can I feel that? Or if we have a partner, they could use their fingers. If the partner's a male, they could use their penis. There's also biofeedback devices that we can get online as well that could potentially play a role if we don't have access to a pelvic physical therapist. Yeah. And things that we would monitor for. So a Kegel is one, but also, do I feel a bulge anywhere? So when I put my fingers in, if it was something on the front wall of the vagina, could be an indication of a bladder prolapse. Or if I put my mirror or put my fingers in, I could feel something coming down from the top. Can I feel my cervix? Or is there something bulging on the back wall? That could be another type of prolapse called a rectocele. But also just paying attention to, do I feel like I can't make it to the bathroom in time? Do I have trouble starting or stopping the flow of urine? Do I have constipation? Do I have pain with sex? So thinking about symptoms that we may have, and then you can do a self-exploration and potentially at some point find somebody that you could see in person.
Yeah. I love both. I love seeing someone, and then I love the idea of self-exploration. I remember I went to this women's conference. It was like this pussy conference, and there was squirting workshops, and this one lady taught us how to use the devices that gynos use to look inside, and we held a mirror and we got to see our cervix because we've never used one. We've never looked inside of ourselves. We just go to these gynos, go to these doctors. We're like young girls laying on these tables. And, without even saying something, someone just sticks something inside and looks inside of us and tells us what's right or wrong. And to have that connection back with our own bodies and to know what's going on with our own bodies, there's definitely something there. There's something in our society that I see starting to move forward and can move forward even more with coming back into connection of what is going on in our bodies. what does it look like down there? What can I test myself? What can I understand with my body? And then, of course, getting professional help as well, I think is so, so valid.
Yeah, it's very empowering. And I think that the challenge with doing an assessment on our own, for some people, it can set off alarm bells because they feel something that they think, oh my gosh, I have a prolapse. And oftentimes it's not. And so then they go down the rabbit hole of, oh my God, I've got a prolapse. So it can set off alarm bells for some. So it's not like I would say to absolutely everybody. I would recommend in person if you could, just to in a safe place where somebody has the knowledge to be able to teach you as you are doing. And you can self-explore while you are with the professional as well.
Yeah.
But I also don't want to limit people or make it that you only can see a professional. There's a lot you can explore and learn on your own as well.
Yeah, totally. I hear that. For me, I definitely want to see a professional to know if anything's going on. But I just like the idea of self-exploring without diagnosing, because I would probably, just be like, oh, something's off here. So yeah, I love that. Yep. And you said prolapse, easily treatable, incontinence, easily treatable. So there's solutions to these. And I know you have so many programs and so many courses and one-to-one support on these things, but do they all have different treatment plans? What are the go-to steps when someone finds out that something isn't right?
Mm-hmm. Really, fundamentally, it's the same approach for most pelvic health conditions. So I often, every day, somebody will message me, does this help with X? Does this help with Y? Does this help with Z? And my answer is always yes. And even if you didn't have X, Y, or Z, I would still say there's benefit to doing these exercises. And we've never again been taught that just like we need movement in the rest of our body to help keep our bones healthy and our muscles strong and our mobility there and keep up our strength, the same thing applies to our pelvic floor. So everybody would benefit from pelvic floor exercise. So when we think about incontinence, some of the reasons why we may leak, with the laugh, cough, sneeze, or jump, is there may be scar tissue from surgery or an injury or childbirth that is interfering with the muscle's ability to react at the right time with the right amount of force. It could also be that the muscles are holding on to more tension than what would be considered optimal. And that's very common. If we're afraid of leaking or we're afraid of not making to a bathroom on time, the muscles are often going to be on guard all the time and they're non-relaxing. Hypertonic muscles also can't generate as much force and will probably not react at the right time. So we might leak a little bit. So when we think about incontinence, it's often about retraining the reaction time of the pelvic floor and also building strength and suppleness. So the ability to let go of tension so the muscles can move through their full range of motion and they can generate the right amount of force at the right amount of time. With urgency, it's often mind, it's behaviors, and it's also bladder irritants. So you being a fairly new mom, it's very common after we've given birth to a babe to be up multiple times a night to feed our babies. And oftentimes we're up and we go to the bathroom. We're up, we go to the bathroom. We're up, we go to the bathroom. And then through the day, you're like, I don't want to have to go to the bathroom. I'm going to go to the bathroom just in case. And we start to get into these cycles where our bladder becomes conditioned to signal much more frequently when it's not actually full. And then that just gets perpetuated through after we're now no longer a mom, we're still waking up because our bladder's been conditioned to do so, or we're still peeing before we leave the house or before we go to exercise class or before this or before that, right? And so we have trained the bladder to signal more often, and we now need to put new inputs into the system so that we retrain it to signal at appropriate times. So that's more urgency. Bladder irritants, also lack of hydration and constipation all kind of fall under that category. Those are all things that we would want to look at. If we're constipated, that's going to be putting pressure on our bladder. Also, probably means we're not drinking enough fluids. And a lot of people who are afraid of leaking or afraid of getting urges aren't drinking enough fluids, thinking that's going to help. But then we become dehydrated. The urine becomes more concentrated. We're not pooping well. Then we have to strain to poop. And now that's a big contributor to organ prolapse. So let's move on to that. With prolapse, when caught early on, it's often a pressure management system problem. So we're generating more pressure downwards, constipation being one of them, pushing with childbirth is another, chronic heavy lifting. And if we don't have resilience and capacity in the muscles to manage that increase in pressure, we can get some descent of the organs or some shifting around. And there are also some people who may have tissue injury. So for instance, childbirth is a big one where there could be damage to some of the supporting structures that all the exercise in the world is not going to change. So we have to look at that. We have to consider that as a potential hurdle for some people. But with prolapse, we need to look at how we're managing pressure. We need to pay attention to our posture, to our breath. We have to build capacity in the muscles to manage the loads. And then one specific exercise technique that's really, really powerful for prolapse is called the hypopressive technique. Hypopressive means low pressure. And this, before low pressure fitness came along, prolapse was something we just had to manage. And we're going to monitor. Hopefully it doesn't get worse. And people were often told, don't lift, don't twist, don't jump, don't run, don't. This huge list of nothing that was possible. And when we think of aging, with our increases of bone loss and muscle loss and strength loss, especially post-menopause, we now are even at greater risk if we're not exercising because we have this prolapse or because we've been told we can't, right? And so when hypopressives came along, all of a sudden, early stage prolapse, people were reversing them or at least improving them. And it can help with incontinence as well. And it's this transformative, life-changing technique that gave hope to the prolapse world and kind of changed the trajectory there. So those are the fundamentals, but there's also the lifestyle component that we need to think about. So I talked about hydration, diet, reducing inflammation, removing bladder irritants, making sure we're not constipated, and then using proper lifting techniques for lifting. So not avoiding lifting. We still want to lift, but we want to progressively load the pelvic floor just like we would any other muscle in the body.
Yep. I saw your hypopressives course. I was really interested. I'm like, oh, I want to sign up for that. This is just such great knowledge. I want to have another baby. And just to have these tools is so invaluable. What do you think about tearing during birth? So if you tear or if you had stitches, does that create more problems? Does that mostly link to more issues in the pelvic floor?
It can, and it can be dependent on the severity of tearing. So it's very common. I don't remember the most recent statistic, but it's over 70% of women will have some degree of tearing. And usually it's superficial. So grade 1 to 2 tearing is superficial. Grade 3, 4 is into the sphincters, into the muscles. And those definitely increase your risk significantly for challenges. So there's a lot of physicians now are becoming more aware of the term called OASIS, obstetric anal sphincter injuries, and are trying to put in place screening, but also mandatory referrals to pelvic floor physical therapy for that population. I petition that I argue everybody, even if you've never given birth, but especially if you've given birth, would go, but then extra especially if you've had a 3rd or 4th degree tear.
Wow.
So yes, it can increase the risk. And the residual scar tissue afterwards can sometimes, as I mentioned earlier, interfere with muscle function. So it's important to help that, make sure that's managed. And that's part of the role of the pelvic floor physical therapist as well.
Yeah. I had 2nd degree tearing and the stitches felt pretty deep though. I felt like 1 year post-birth, I could feel the healing, the scar tissue so much that I could feel during sex. And I just had no idea that for 1 year I'd be on this healing journey. And I feel like I'm still on that healing journey. And now it's really getting into the pelvic floor health and things that you're sharing. Now that's what I'm so into. But I didn't know how important it was. And I also didn't know how long the healing journey would be. And I think a lot of women are surprised by that, about how long the healing journey is after having a baby and how long it can be. And we just think our body's going to bend right up. But yeah, if we did tear, if we did have stitches, the scar tissue and different ways that it can pull on the body, I think there's a lot to learn that I don't know and that we don't know.
Yeah. And even somebody who had no tearing and had this perfect, quote unquote, perfect birth, there's still disruption to the anatomy and the landscape. And we still need to heal. And you living right now in a culture where that is really, truly honored and valued. North America, it is absolutely not. It's honored if you are back at the gym at 2 weeks postpartum and don't look pregnant anymore. That's what's celebrated. And I think that's doing such a disservice to this absolutely essential part of postpartum recovery or post-op recovery. But the other piece I want to highlight on that is you mentioned healing journey. And my first child is over 19. Almost, he's on his way to being 20 years old, which is shocking to me. 3 years ago, I had a prolapse surgery. And I've recently gone and had some, if you've heard of PRP, which is the platelet-rich plasma injections that are being used for joint regeneration. A lot of facial stuff is being used. It's now starting to come into the pelvic health realm as well. And so even though I'm not healing postpartum, I'm navigating pelvic health for my whole life. I'm now postmenopause. And so this isn't just do Kegels when you're pregnant or see a pelvic floor physio when you're postpartum or postpartum healing, and then we're good. This knowledge is something we need and benefit from and will help us through the various life stages as we age, as we lose collagen, as we lose muscle mass. We have to fight against that. We have to fight hard. And if we have the knowledge, we're armed and ready and we know what to do. If we don't have the knowledge, we don't quite know what to do or that there's even something that we need to fight for.
Wow. And you're right. This is a lifelong journey. This is not just for mamas after birth. This is for every age, every stage. And Kegels, do you think that is something that we should be on a lifelong journey with? And I know I've listened to so many other podcasts and stuff like, trying to figure out like Kegels, are we doing it right? Do we know what we're doing? So first, I feel like it's going to someone who can really show us if we're doing it right. But do you think this is a lifelong journey also doing Kegels and working on that as well?
Yes and no. So Kegel, Dr. Arnold Kegel, that's where Kegels came from. He was a physician in California, I think it was in the 1940s. And he saw his patients after birth having difficulty contracting and relaxing their pelvic floor. So he used this device called a perineometer, which is a biofeedback device that would help people see the activity of the pelvic floor, the contract and relax. And that's what ended up becoming the Kegel exercise. What we think of, what people associate with a Kegel is a squeeze. Just squeeze as hard as you can, and we should be doing hundreds of these a day. And we have loads of evidence to show that Kegels are very effective when they are done correctly, when they are done consistently. We have also evidence to show that the majority of women are doing them incorrectly because we've never been taught. And so back to if we just learned about pelvic physio and went to these practitioners early on, we would have these tools without having to go through years of struggle and disconnect to have to now to try to connect to this group of muscles in our body. So Kegels play a role and they can help with blood flow, circulation. They can help overcome things like incontinence. They may play a role in helping with prolapse symptoms as well, with chronic back pain. But we also don't have any evidence yet. However, I do poll pelvic physios that I talk about. The vast majority of people they treat are on the hypertonic side, more tone than what would be considered optimal in the pelvic floor. So if we have more tone in a muscle group, if we then add more contraction, especially if we're doing it incorrectly and we're just thinking about squeezing, we can end up exacerbating that imbalance of tone. A lot of people are told don't do Kegels if they have a tight pelvic floor or hypertonic or non-relaxing. Those are all terms they may hear. They're often told not to do Kegels. And while I agree that initially it's not where we would start, we want to work on relaxing, we want to work on connecting to the breath, looking at posture, but we still want an opportunity for those muscles to go through their range of motion, which is Kegel. So voluntarily contracting and lifting and relaxing the pelvic floor is a Kegel. And so I am a believer in them. And my approach has always been Kegels in and of themselves, while we do have evidence that they work, they're kind of limited because people do them sitting in a chair, or they do them at red lights in the car, or they do them laying on their bed. And while that's better than nothing, most symptoms like leaking or prolapse heaviness are happening when we're upright against gravity, lifting weights, maybe going to the gym, pushing a heavy door open. So we need to train the pelvic floor dynamically. So understanding Kegels, understanding how to relax the pelvic floor, how to contract and lift, so how those muscles are coordinating with our breath. Then we layer it into whole body movement. And we have a couple of new pieces of research. One was looking at Kegels done prior to resistance training compared to Kegels alone, and there was better outcomes with the combined group. There was another one that looked at Kegels as part of resistance training, that's supporting my bias. That's how I train people. We connect with the pelvic floor, we layer it into movement, then we start to progressively load it with resistance training. So this study, confirming my bias, showed that there was quicker outcomes, and this was in an elderly population with incontinence, which I thought was really cool. So I am a supporter of every day or every couple of days checking in with your pelvic floor, going through a couple of sets of Kegels in an unloaded position just to connect with the pelvic floor, but make sure we're bringing it into our movement. So most of us are working out. I'm hoping most of us are working out because it's important, especially as we're aging. And once we understand how the pelvic floor works and that it's part of our core, we can bring it into our bicep curls or our push-ups or our planks or squats or lunges. And we can really make those exercises a lot more powerful, but also really harness the capacity of our pelvic floor and make sure that the pelvic floor is being used and influenced by those movements, even if we're not adding that voluntary contract and lift and release. So I'm not saying that we should always do that for every single movement, but initially while we're rebuilding and connecting, add it to those movements. And then later on, we can just exercise a bit more freely, but always have some sort of dedicated, whether it's one portion of your workout or just a set of Kegels. I think it's really important to keep the connection to that pelvic floor and also to make sure that we have time to release and let go of tension because life is stressful.
That's what I imagine. Like, we're so stressed out as mamas and everything. We're just like clenching everything. And like, that's, you said, the Kegels, we're just squeezing, but we're not releasing. And the biggest takeaway I'm getting is like, it's just really bringing mindfulness to it, bringing mindfulness to our breath, to our posture, to our fitness, to our workouts, and our mindfulness connecting with our pelvic floor and that translating it just like into our lifestyle, into our everyday.
Yeah, 1,000%.
Fitness wise, are you open to all different type of workouts, whether it's Pilates, yoga, weightlifting? Are you open to all these workouts and then just bringing mindfulness into the pelvic floor and integrating that into the workouts? Or are there specific workouts you like to heal the pelvic floor?
I love a variety. I like diversity. And I think looking back, when I first started talking about this 19 years ago, I didn't know of anybody else from a fitness perspective, being a personal trainer, talking about the pelvic floor. And the people I was learning from were pelvic floor physical therapists. And at the time, they hadn't really considered the fitness component per se. There wasn't any research about it. And so what we did have was pretty limited. And as I said, there was a big don't list, don't do all these things. And so that's what was preached for a while. Oh, Pilates is bad because there's too much flexion. Oh, yoga seems fine, but that creates a lot of intra-abdominal pressure for many people. Oh, you can't lift anything over X pounds because that's going to make your prolapse. It was so limiting. And that's what we all did for a while. But then one of my teachers, Katie Bowman of Nutritious Movement, she's all about natural movement. And she had a blog, Katie Says, I forget what her first brand was, but I think it was the Restorative Exercise Institute. I think it was what it was. But then she rebranded to Nutritious Movement. And I absolutely loved that branding and marketing because her philosophy is we eat a diversity of foods to make sure we get all the nutrients for our body. And we look at movement. She looks at movement the same way. We need this diversity of movement to ensure that we have mobility and strength and suppleness throughout our body. And for so long in the pelvic floor world and diastasis, which we haven't talked about yet, but we were in this very narrow range of motion movement. And it was so limited that it was creating other issues because we didn't have capacity and resilience in getting out of bed for our babe that was crying in the middle of the night. And so I initially was very in that restricted motion or mode. And I've broken out of that. I like all movement, whatever brings you joy.
Love
and
that.
From a retraining perspective, if somebody is symptomatic, I do have sort of a protocol of reconnecting to the pelvic floor, layering it into movement over a series of weeks and progressively loading from there, and then bringing those principles into whatever it is that you want to do. But let's come back to the starting point here of connecting the pelvic floor and the breath and then layer it in from there. And you can bring that philosophy to yoga or Pilates or HIIT or resistance or whatever it is that you want to do.
I think we're all just missing this fundamental knowledge, this fundamental piece that we can bring into any workouts that bring us joy, like you said, which I love because as a mom, workouts bring me so much joy. Mm-hmm. But I feel like I never got that fundamental knowledge of how to bring pelvic floor mindfulness, breath into it to make sure that it is restorative for my body and not damaging.
Yeah. And as we're aging, when we think about post-menopause, where I am right now, we lose up to 10% of our bone mass in the first 5 years post-menopause. Wow. That's huge. Wow. And the increased risk of cardiovascular disease. And if we're not moving because of our pelvic floor or not moving in fear of or not moving with diverse ways, then we're increasing those already increased risks. So,
Yeah. Wow.
yeah, that's my bias.
There's just so much that a woman's body goes through
Yeah.
in her lifetime. So many pivotal, important moments
Mm-hmm.
that I think we need to talk more about and dive into more research and learn more from you. My next question. So I've heard you talk about certain devices. I've heard you talk about certain things that you like to use. I heard you talk about the Epino, Kegel weights, vaginal moisturizer, which I'm so curious about. So what are some of your go-to devices, products, things that you like for women that you would recommend?
Mm-hmm. Vaginal estrogen is, I'm calling it an essential nutrient. So
Wow.
from the age of about 45 onwards, pretty much every single woman would benefit from being on local vaginal estrogen. So this is estrogen placed inside and around like the vulva and the opening to the vagina to help reduce the risk of our increased risk of UTIs when our estrogen declines, keep resilience in the tissue, help with urinary frequency, help prevent painful sex or treat painful sex. It is essential. So that's one thing that if you're around the age of 45 earlier, if you have symptoms that indicate early postpartum, sometimes people will use vaginal estrogen as well because we're in a low estrogen state.
Yeah.
So that's one thing. The next, vaginal moisturizer, is another that I consider essential. We spend so much time caring for our face and putting on creams and lotions and potions and seeking treatments. And we have tissues around our vulva and our vaginas that benefit from very similar care. Hyaluronic acid is a molecule that we produce in our bodies, but we produce less as we age. And hyaluronic acid has the capacity to retain huge amounts of moisture. And so a lot of face serums will have hyaluronic acid. A lot of even oral supplements that we take will have hyaluronic acid to help with skin moisture and just moisture in our bodies. So hyaluronic acid vaginal moisturizers help retain moisture in those tissues. And we can use that anytime. We can use it multiple times a day, starting whatever age. I think that's an essential part. So after I shower in the morning, I put on my moisturizer. At night, twice a week, I use vaginal estrogen. Lubricant for insert of sex, whether that's with or without a partner, with a device or not. And different types of lubricant, water-based, especially if you're using any sort of toys or devices, but there's tons on the market that are great. And then from a device perspective, one of my favorites is called the V Sculpt. If you're in Canada, it's called the V Fit. If you're in the United States, it's the same device. It's just Health Canada versus FDA naming. It uses red light therapy, infrared heat, and sonic vibration. And I'm a huge fan of red light therapy. Love infrared, love all the benefits from a tissue support perspective. And the addition of the sonic vibration, if we think about those vibration plates or platforms that people stand on, there's loads and loads of evidence about the benefits of vibration training in terms of recruiting more muscle fibers. There's other benefits, but recruiting more muscle activity. And so when we think about a device that is vibrating internally, if we were to even just allow it to vibrate, it can elicit a relaxation response and help blood flow and circulation. But if we were to do our Kegels, our contract and relax against that vibration, we can bring about more muscle activity. Plus, we're getting the benefit of the infrared and the red light, which can help from a tissue support perspective. And that can really help as we're aging, again, losing collagen, losing hyaluronic acid, losing estrogen. It's not going to replace our estrogen or hyaluronic acid, but it does help with collagen production. So for people who are experiencing thinning or drying or discomfort, it can really be helpful. So that's one of my favorite devices. I've been using it for years and years and years, and I love it. Kegel biofeedback device, Kegel devices like PeriFit or the LV are great. And again, especially if people aren't able to see a pelvic floor or physical therapist in person, these can be a great way to have something that measures if we're contracting and relaxing. So you play video games with your pelvic floor. These devices attached to an app. And when you contract and relax your pelvic floor, you can see the little character jumping over mushrooms or trying to miss birds in the sky or something. So it's fun. It's engaging and it's a way to monitor. So I do like them. If you have access to a pelvic floor physical therapist wherever you live in the world, I would invest my money with them first before a device. I want to make that very clear. So I would always invest first in pelvic floor physical therapy. But devices can play a role if you don't have access, or they could be something that your therapist might recommend and say this could be helpful for you from a maintenance or monitoring perspective. And then Kegel weights, same thing. The book 50 Shades of Grey really heightened the awareness of Benoit balls and Kegel balls. And everybody was running out to get these and thinking we were going to have our sex life was going to be transformed. And for some people, true. But coming back to the point of if somebody has more tone and part of the reason they're leaking or experiencing prolapse symptoms or pain is because of more tone, if we put a weighted device inside that we now need to hold on to, we're creating more tone. So it may not be the solution that we think that it's going to be. It can be a progression. So for people who are doing the core breath and layering it into movement and looking for that next step, it can absolutely play a role. Just like we carry dumbbells in our hands and do bicep curls, we can benefit from weighted devices, but it wouldn't be the first option that I would choose for somebody.
Very inspired to get the V-Sculpt and the moisturizer. I just have never thought of that. And why wouldn't we? We do all these steps on our face and our body. What moisturizer do you like the best?
The one I like is called Feel Amazing. And there's a link to it on my website in
Cool.
vaginacoach.com/vaginacoach. And some of them are like little ovules you put in. This one is just, it's a gel. It's not sticky. It's not tacky. There's no goo or smell. And it's just super easy. You don't even know it's on other than you feel amazing. But the other ones I find that there's a little bit of goopiness as they go throughout the day. So they're not my fave.
I will link that. And then what about lubricant? Are there certain lubricants you like? Because I feel like so many lubricants have all these weird ingredients that I don't know what it is. So are there certain lubricants that you like better?
Oh gosh, I've tried. I have so many
tried all of
companies
them.
have sent me their lubricants. My husband gets all excited. Woohoo, we get another one to try. But some of it's personal preference, but some of the ones that I like from an ingredient perspective, Good Clean Love is one. Yes, personal lubricants is another. Sliquid, there's Liquid Organics is another one that I like. There's some that are technically, like there's a product called V Magic.
Yeah.
It's technically not a lubricant. It's more of a balm that people could use like a moisturizer, but it doesn't necessarily go internal. Even though it's safe to go internal, they can't market it. It's all about what claims a company can make. So off-label use, I really like that as a lubricant as well. There was another one called Vital Vulva is what it used to be called. And now it's called Vital V, which also technically not designed as a lubricant, but I have liked it. And there's another new one. And it's a cool story. This woman, I think it was 53 when she finally had her first orgasm.
Wow.
And she and her husband, I think it was her husband. I don't want to speak totally out of turn, but I think it was her husband who created this company called Pleasure Pods.
Wow.
And it is almost like a half egg shape. It's wrapped up, but you just basically hold it in your palm and the heat will soften it and create lubricant. I will tell you, my husband really loves that one. And
cool. Get in that one.
Yeah.
Whoa,
so
wow.
There's lots.
You have so many recommendations and you get so many free lubricants.
Yeah.
Do you think this information will change our orgasm, our sex life? Do you think?
Mm-hmm.
Yeah.
Yep. So like this woman, for some people, understanding the pelvic floor and the capacity of the pelvic floor and that the pelvic floor is an essential part of its job is sexual response. It could allow somebody to have their first orgasm. It could allow the orgasm to be more heightened. So some people, as they strengthen their pelvic floor, increase blood flow and circulation, which is an essential part of lubrication and achieving orgasm, they notice that it's better. Some people are not able to achieve orgasm because of tightness. And so when they can free up that tension and increase that blood flow and circulation, their sensation improves. And again, their capacity for orgasm does. So 1000%.
Wow. I feel like you are just changing so many women's lives in so many ways in regards to their body and their health and their sex life. Like it's just, the impact is endless. So the last thing I want to talk about is, where would people start with you? Is there a specific course, a specific piece of information they should dive into with you? Because you have so many offerings. Where should we start to start to gain this knowledge and wisdom?
I'm trying to simplify things, and really where I want people to go and where I feel I offer the most value is through my membership. And while not everybody wants to commit to a membership right away, there's an introductory program called the Buff Muff Method. And it lays pelvic health 101. What is the pelvic floor? What is it doing? What is it? So some of the stuff that we've talked about here, what are the more common signs and symptoms? What does it look like? What does it feel like? What we can do about it, some lifestyle tips, and then exercise. So
Cool.
the foundation exercise of the core breath that I call it, and some key exercises that they can layer it into, a couple of workouts, an introduction to hypopressives. So that's where people start. And then from there, that might be all they need or want. And they've got a couple of little workouts they can carry on. Or if they want more, then they come in and there's a 28-day challenge, and there's a membership where I have over 75 different workouts of HIIT, resistance, yoga, you name it, chair-based exercises, and meal plans, because we benefit from eating well or eating in ways that support our pelvic health, and coaching. So there's coaching calls that people can come on to and ask questions and be part of a community. Because I think there's so much where we just sit here Googling and we're like, oh my God, I'm the only person in the world that has this. And we feel ashamed and embarrassed and lonely. And I think that it's really important to recognize that so many of us are going through this, and you're not alone in this journey. And we can create a safe place for people to ask, because so often they're embarrassed. Their doctor, like, I have this problem and I really don't want to talk about it, and I only have 7 minutes. And then we leave, and they're given a prescription for something they don't even know why they have a prescription for. They're sent on to a referral to a surgeon, and they're just thinking, oh my, do I need surgery? And it's really important to me for people to feel safe and supported. So that's a big part of the membership, is the community space. So that's where, and if people are like, I don't want to do anything online, or this is an app, I also have a book you mentioned earlier in my intro called Your Pelvic Floor. You can find that on Amazon, and it's also a good place to start.
Wow. Thank you so much. I will be signing up for your membership. I'm so excited to learn more. Why wouldn't we? Why wouldn't we learn about our bodies and know more to set us up for success for the rest of our life, for the rest of our babies, for the rest of menopause, aging, just everything that happens. So I'm so excited to learn this information. And I hope everyone listening as well is excited to dive in and join the membership with me. I'd love to see everyone there. Thank you so much. Thank you for being here. Thank you for changing the way that women see this. Thank you for giving us so much understanding. I have learned so much, and I can't wait to learn more from you. Is there anything else that you want to leave with everyone, where to find you? I'll link everything, but is there anything else you want everyone to know?
I think really my big message is you're not alone. So many solutions are available. Many we didn't even talk about. There is so much hope and opportunity for people. So don't accept that pads are your destiny. Don't accept that this is just part of being a woman, and find your peoples, and you can totally transform your life.
Thank you so much, Kim. Thank you.
You're welcome.
I appreciate everything you do, and I will see you in your membership.
Thank you.
All right, Mama, thank you for tuning in. I am sending you so much support and love on your journey through motherhood. Remember, you are not alone in this beautiful, wild, and sometimes challenging journey of motherhood. This is your village. Please subscribe, leave a 5-star review, and share this with anyone else that you think would benefit. Take care, Mama, and I will see you next week. Thank you for being part of the Mama culture.